Schizophrenia is defined as a psychotic disorder that may involve characteristic disturbances in thinking, perception, speech, emotions, and behavior. Schizophrenia has no cure, so treatment is aimed at curing the symptoms. Not all people with this disorder share the same set of symptoms. There are two main types of symptoms, positive and negative. Positive symptoms are more obvious signs of psychosis, while negative symptoms indicate an absence of normal behaviors. Some examples of positive symptoms include delusions, which are beliefs that would be thought by most as a misinterpretation of reality, hallucinations, which is something that is seen, heard, or sensed, even though it isn't there. Negative symptoms include alogia, which is the absence of speech, and anhedonia, the lack of pleasure. Affective flattening is similar as a lack of emotion is shown. There are also symptoms referred to as disorganized. For example, disorganized speech is when patients can't have normal conversations and often don't respond appropriately. Inappropriate affect is closely related and occurs when patients exhibit behaviors such as laughing or crying at inappropriate times. Catatonia is a major disorganized symptom. It can involve weird positions, refusal to move, and complete unawareness to environments around. An estimated 1 in 100 people are affected by schizophrenia at some point in their lives. There are many different treatment options involved in treating schizophrenia. Meds are one of the major treatment options used to help treat people for schizophrenia. They help approximately 60 to 70% of the people who take them. There are both first and second generation pills. Second generation were thought to have less side effects than first, however, it turns out that's not exactly true. There are a lot of issues with non-compliance, which involves patients not taking their medicine the way it's supposed to. This is because some of the side effects can include problems like shaking and motor issues. There's also a disorder from long-term use called tardive dyskinesia, which is a repetitive face movement that is against their will. There are some key psychosocial treatment recommendations, including assertive community treatment, which is for those at risk of repeated hospitalizations or those with recent homelessness. There is a multidisciplinary team that consists of prescribers, team members, and there's a low patient-to-staff ratio. So medication adherence is also emphasized with this type of therapy. The results of 6 randomized trials found that ACT, assertive community treatment, is associated with a 37% greater reduction in the homelessness relative to standard community care. It reduced hospitalization at 1 out of 2 sites at a higher institutionalization level prior to the study. There are 2 other key aspects, including supported employment and skills training. Supported employment is when they help people with schizophrenia achieve competitive employment, work more hours, and earn more higher wages. Then skills training kind of ties into that, where it's in order to improve social interactions, independent living, and also ties into being able to hold a job. 28 schizophrenic male patients were randomly assigned to either intensive social skills training or holistic health therapy. An evaluation was conducted before and after 9 weeks of inpatient treatment, as well as before and after 24 months in the community. Patients who were exposed to social skills training showed significantly greater acquisition, generalization, and durability of social skills. Their social adjustment in the community was rated as better by significant others. They experienced fewer relapses and rehospitalizations than those in the group that got holistic health therapy. Cognitive behavioral therapy is another one that's just as important as medication usage. People with schizophrenia who have persistent psychotic symptoms while receiving the adequate medication should be offered also cognitive behavioral therapy to reduce the severity of symptoms. The intensity and duration of the therapies have been studied, and they vary from 6 to 50 sessions, weekly, bi-weekly. A treatment period of 4 to 9 months is the most typical treatment duration, and it has shown to be very effective with medication usage. 14 studies that included over 1,400 patients published between 1990 and 2004 were identified, and a meta-analysis of their results was performed. CBT showed a significant reduction in positive symptoms, including hallucinations and delusions, and it seemed there was a higher benefit for patients showing acute psychotic episodes. There was a 57% improvement rate with CBT versus the 27% improvement rate with just medication. Often used in group home and institutionalized settings, token economy is when patients can earn tokens or whatever it may be as a reward for acceptable behavior that's appropriate, and then they can then use those to get a bigger thing like free time or whatever it is they would like. 18 chronic schizophrenic patients were divided into 3 groups. One group was a no treatment control group where they didn't live in a token economy ward, and the other 2 groups that did live in a token economy ward. So the token groups received tokens, social reinforcement, and informational feedback for appropriate behavior, while the control group only received the last 2. This was done for 15 months. The introduction of the tokens had an immediate positive effect in all 3 areas of behavior, but it slowly disappeared over the 15 months, and the only significant improvement was shown in the area of social withdrawal. Usually, family-based services are not available because the family does not choose to be around the person with schizophrenia, but it should be offered, and it should last at least 6 to 9 months. They've been found to significantly reduce rates of relapse and rehospitalization. Most investigations focused on family interventions that were 6 months or longer included individuals who had a recent illness, exacerbation, so a recent psychotic episode, and these studies demonstrated much lower rates of relapse and rehospitalization. A total of 172 patients aged 18 to 45 years with schizophrenic disorders were randomly assigned to single or multiple family psychoeducational treatment at 6 public hospitals in the state of New York. Psychotic relapse, symptom status, medication compliance, rehospitalization, and employment were all looked at over a 2-year period. The multifamily groups showed a lower relapse rate. Their relapse rate was only 16%, while the single family was 27%. Rehospitalization rates and psychotic symptoms decreased significantly, and medication compliance was high in both groups. 6 patients were randomized to low or medium drug dosage and to family or no family therapy. 6 weekly family meetings were conducted at the clinic. After 6 months, 48% of the low-dosage no therapy group had relapsed. 22% of the low-dose therapy group had relapsed. 14% of the moderate-dose no therapy group had relapsed. And absolutely 0% of the moderate-dose therapy group had relapsed. As seen by the chart, this experiment was recreated several different times by several different people and yielded very similar results. It appears the best treatment for schizophrenia is a combination of both medicine and cognitive behavioral therapy. If possible, family behavioral therapy has shown to help significantly.